Hey, this is Dr. Brian Kinsel with Bob Flagstaff showing a band hip internal rotation mobilization. So the hip rotating inwards, we need that to get into extension, also into the bottom of a squat. And so limitations in this hip internal rotation range of motion is a common thing I see in individuals who are a little bit stiff. They have a little hypomobility of the hips, and particularly when they have pain, lower back pain, with running potentially, with extended walking, or hip pinching or pain with squatting. So those are just a couple examples of when we might use this. So this can be tricky to get on your own, and so a band here is really helpful to get into this position comfortably. So I'm going to get this low in my hip crease, low on a door anchor or on a squat rig, and I'm going to get some pretty good tension on this thing. And then I'm going to let it pull me laterally to the side. This is called a distraction force. And once I'm here, I'm just going to sit that down the hip crease a little bit more. And so hip internal rotation is the femur going in. So that's this way. So even though my foot comes in here, the femur's going out. So that's external rotation. I'm going to go the other way. So I'm going to just keep this seated. Foot goes out, knee goes in. I'm just going to stabilize with my other side. And then I'm going to rock up and down here into this internal rotation range of motion. Trying not to lift my pelvis. If I just come here, then I'm getting that through my back or just my torso. And so I want to keep my hips, my pelvis, my back on the floor and just go through the hip. You might not have a lot of range here, and that's okay. So I'm going to actively work in this range. And then if you feel comfortable, I'm just going to cross a leg over and let that just kind of pull it down. I'm still trying to keep my hips flat as best I can. You might even sneak the foot out a little bit. And you're going to rotate in like that. You can hang out in this stretch for a little bit. And then you can go back to working actively. You might find you have a little more range. And then you can kind of just get down to this range and hang out again. So this is our hip internal rotation range of motion. Just a couple other variations in the same position. I can then bring my leg up here, and internal rotation is that way, right? So I'm going to try and steer the leg with my hands and just get a little bit of active motion into internal rotation. I don't like this one as much because it's just harder to feel relaxed here. And so this one I found to be a little bit more effective. We have another version on hands and knees, which looks like this. So you can check that out. Both are great, but some people aren't comfortable on their knees. So again, we would use this for hip hypomobility causing some hip or back pain. We would not want to use this if you have a hypermobile hip or a lot of range in your hip. And so sometimes the same symptoms, pinching and pain around the hip, can be caused by different things. And so stiffness or hypomobility, there's going to be a different set of fixes for somebody who has a lot of motion. They probably need more motor control, motion control, strength, and endurance. Regardless, after we use this, I want to get a couple active reps of range of motion. So I'm going to come up and just test maybe a couple air squats and see how I'm feeling, dropping in and out. I should feel like I got a little more range in that hip. And doing an active range of motion like this is going to help our brain realize, like, hey, I have that range of motion, I can use it now. So we always want to follow a passive stretch or mobilization with an active movement. So that's our hip internal rotation mob. Give it a shot. Let me know how it goes.